Eat weight disorder. 2024 June 8, 29, 142. doi 10.1007/S40519-024-01669-1. Abstract. Purpose. The Eating Attitude Test, 26, EAT 26, is a screening tool for eating disorders, EDs, in clinical and non-clinical samples. The cutoff score was suggested to be varied according to target population. However, no studies have examined the appropriateness of the originally proposed score of 20 for screening DSM-5 eating disorders in Japan. This study aimed to identify an appropriate cutoff score to better differentiate clinical and non-clinical samples in Japan for EDs. Methods. The participants consisted of 54 patients with anorexia nervosa restricting type, 58 patients with anorexia nervosa binge eating/purging type, 37 patients with bulimia nervosa diagnosed according to DSM-5 criteria, and 190 healthy controls, HCs. Welch's t-test was used to assess differences in age, body mass index, BMI, and total EAT 26 scores between HCs and patients with EDs, receiver operating characteristic, ROC. Analysis was conducted to identify the optimal cutoff score. Results. The HCs had significantly higher BMI and lower total EAT 26 mean scores than patients with EDs. The area under the ROC curve was 0.925, indicating that EAT 26 had excellent performance in discriminating patients with EDs from HCs. An optimal cutoff score of 17 was identified, with sensitivity and specificity values of 0.866 and 0.868, respectively. Conclusions. The result supports the suggestions that optimal cutoff score should be different according to target populations. The newly identified cutoff score of 17 would enable the identification of patients with EDs who have been previously classified as non-clinical samples in the EAT 26 test. Level of evidence. 3. Evidence obtained from case control analytic study. PMID 3885039DI 10.1007/S40519-024-01669-1. Document the CPD share evidence. Estimated reading time, 5 minutes. Latest, psychiatryai.com #Razor4D. Cool evidence, engaging young people and students in real-world evidence. Real-time evidence search, psychiatry. AI research. The optimal cutoff score of the Eating Attitude Test, 26 for screening eating disorders in Japan. Title. VR-related evidence matrix. Eating disorders and disordered eating behaviors among undergraduate students in Pakistan as measured by Eating Disorder Examination Questionnaire, EDQ. Course of avoidant/restrictive food intake disorder. Eat weight disorder. 2024 June 8, 29, 140. doi 10.1007/S40519-024-01670-8. Abstract. Purpose. High levels of physical activity have been documented in eating disorder patients. Our aim was to examine whether adolescent leisure time physical activity is prospectively associated with eating disorders in adolescence and young adulthood. Methods: Finnish twins born in 1983 to 1987 reported their physical activity frequency at ages 12, 14, and 17. A subsample of participants underwent structured, retrospective interviews for eating disorders at the mean age of 22.4 years. Associations between female twins' physical activity and future eating disorders: 571 to 683 twins/WAVE were investigated with the Cox proportional hazards model. To illustrate the physical activity similarity of the co-twins in a twin pair, we used cross-tabulation of eating disorder discordant twin pairs, 13 to 24 pairs/WAVE. Results: After adjusting for several covariates, we found no statistically significant longitudinal association between physical activity and eating disorders. This applied when all eating disorders were combined, but also when assessed separately as restrictive and non-restrictive eating disorders. Co-twins' physical activity in adolescence tended to be similar irrespective of their future eating disorder, supporting the results of the regression analysis. Conclusion: We observed no evidence of adolescent physical activity frequency being prospectively associated with eating disorders in female twins. Further longitudinal studies with larger sample sizes and more detailed physical activity data are needed. Level of evidence. 3. Evidence obtained from cohort or case control analytic studies. PMID 388503337DI 10.1007/S40519-024-01670-8. Document the CPD share evidence. Estimated reading time: 4 minutes. Latest: psychiatryai.com #Razor4D. Cool evidence: engaging young people and students in real-world evidence. Real-time evidence search: psychiatry. AI research. Adolescent leisure time physical activity and eating disorders, a longitudinal population-based twin study. Title: VR-related evidence matrix. Exercise identity and physical activity behavior during late adolescence, a 4-wave cross-lagged panel model. Comparison between physical activity and stress-related lifestyle between orthorexic and non-orthorexic university students, a case control study. Comparison between physical activity and stress-related lifestyle between orthorexic and non-orthorexic university students, a case control study. Personality and motivation of physical activity in adolescent girls, effects of perceived parental support and social physical anxiety. Mole Psychiatry. 2024 June 7th. DOI 10.1038/S41380-024-02601. W. Online ahead of print. Abstract. Anorexia nervosa, AN, is a complex metabolic and psychological disorder that is influenced by both heritable genetic components and environmental factors. Exposure to various environmental influences can lead to epigenetically induced changes in gene expression. Epigenetic research is still in its infancy, and studies to date are limited in determining clear, valid links to disease onset and progression are limited. Therefore, the aim of this systematic review was to compile and critically evaluate the available results of epigenetic studies specifically in and to provide recommendations for future studies. In accordance with the PRISMA guidelines, a systematic literature search was performed in 3 different databases, PubMed, Embase, and Web of Science, through May 2023. 23 original papers or conference abstracts on epigenetic studies in and were collected. Epigenome-wide association studies, EVASAs, which analyze DNA methylation across the genome in patients with N and identify potential disease-relevant changes in promoter/regulatory regions of genes, are the most promising for future research. To date, 5 EVASAs on and have been published, suggesting a potential reversibility of malnutrition-induced epigenetic changes once patients recover. Hence, determining differential DNA methylation levels could serve as a biomarker for disease status or early diagnosis and might be involved in disease progression or chronification. For future research, EVASAs with a larger sample size, longitudinal study design, and uniform methods should be performed to contribute to the understanding of the pathophysiology of AN, the development of individual interventions, and a better prognosis for affected patients. PMID 388495160OI 10.1038/S41380-024-02601 W. Document the CPD share evidence. Estimated reading time 5 minutes. Latest psychiatryai.com #Razor4D. Cool evidence, engaging young people and students in real-world evidence. Real-time evidence search, psychiatry. AI research. Epigenetic alterations in patients with anorexia nervosa systematic review. Title: VR-related evidence matrix. iPSC-derived models for anorexia nervosa research. Association of serotonin receptor gene polymorphisms with anorexia nervosa, a systematic review and meta-analysis. Gestational epigenetic age and ADHD symptoms in childhood, a prospective, multi-cohort study. Epigenetic modifications of DNA and RNA in Alzheimer's disease. Epigenetic mechanisms linking early life adversities and mental health. Exploring the epigenetic landscape, the role of 5-hydroxymethylcytosine in neurodevelopmental disorders. Exploring the influence of stress on aggression. Group cognitive remediation therapy for adolescents with anorexia nervosa, outcomes before, after, and during follow-up in a real-world setting in Japan. June 8, 2024. Evidence. Clin Child Psychiatry. 2024 June 7:13591045241259255. DOI 10.1177/13591045241259255. Online ahead of print. Abstract. Objective, cognitive remediation therapy, CRT, can be used as an adjunct treatment for adolescents with severe and complex anorexia nervosa and requiring inpatient treatment. However, there has been only one study on CRT for adolescents with and in Japan. This study explored group CRT as an adjunct to inpatient treatment for Japanese adolescents with severe and complex and requiring inpatient care. Methods: 31 adolescents with and underwent group CRT. Neuropsychological, set shifting and central coherence, and psychological assessments, motivation, self-esteem, and depressive symptoms were measured before and after the intervention. Weight and symptoms were measured before and after the intervention and at follow-up, and the adolescents completed post-intervention and follow-up questionnaires. Results: set shifting led to medium to large effect size improvements. Medium effect size improvements in central coherence and depressive symptoms were also observed. The feedback from the adolescents was mainly positive, and the treatment completion rate was high. The patients also reported that the skills learned through group CRT could be applied in daily life. Conclusion: group CRT may be beneficial for adolescents with severe and complex and who require inpatient care. PMID 3884936 doi 10.1177/13591045241259255. Document the CPD share evidence. Estimated reading time 4 minutes. Latest psychiatryai.com #Razor4D. Cool evidence, engaging young people and students in real-world evidence. Real-time evidence search, psychiatry. AI research. Group cognitive remediation therapy for adolescents with anorexia nervosa, outcomes before, after, and during follow-up in a real-world setting in Japan. Title: VR-related evidence matrix. Intensive cognitive behavioral therapy for adolescents with anorexia nervosa, outcomes before, during, and after the COVID-19 crisis. Examining the impact of a group treatment using cognitive and social cognition remediation for young offenders, the Justice Health NSW School Link Advantage Pilot Study. Enhancing emotional abilities in anorexia nervosa treatment, a rolling group cognitive remediation and emotional skills training protocol. Determinants and risk factors for renal damage. Where do patients hospitalized for severe anorexia nervosa stand? A multi-center study. June 6, 2024. Evidence. Eat Disorder. 2024 June 5, 12, 172. doi 10.1186/S40337-024-01024W. Abstract. Background. Although renal damage is increasingly reported among the most undernourished patients with anorexia nervosa, and it remains underestimated in current practice and often associated with acute dehydration. The purpose of our study was to evaluate the frequency, the extent, and the risk factors of renal involvement among adolescents and adults hospitalized in specialized units for N. Methods. In this multi-center study, 197 consecutive participants were included, aged 13 to 65, from 11 inpatient eating disorder psychiatric units. Information on the course of N, clinical characteristics, biological data, and medication were collected. Results. At admission, mean BMI was 13.1, plus or minus 1.6 kg/m2 for a mean age of 20.74, plus or minus 6.5 years, and the Z-score was 3.6, plus or minus 1.33. 6 participants, 3%, had hyponatremia, 2%, had hypokalemia, and 4.5%, had hypochloremia. The blood urea nitrogen/creatinine ratio was over 20 for 21, 10.6% participants. The mean plasma creatinine was 65.22 plus or minus 12.8 mol/L, and the mean eGFR was 74.74 plus or minus 18.9 mL/min 30. 5 participants, 17.8%, had an eGFR greater than 90 milliliters per minute, 123, 62.4%, from 60 to 90 milliliters per minute, 35, 17.8%, from 45 to 60 milliliters per minute, and 4, 2%, under 45 milliliters per minute. In multivariate analysis, only BMI on admission was a determinant of renal impairment. The lower the BMI, the more severe was the renal impairment. Conclusion: when eGFR is calculated, it highlights renal dysfunction found in severe and requiring hospitalization in specialized units. The severity of undernutrition is an independent associated factor. Kidney functionality tests using eGFR, in addition to creatinine alone, should be part of routine care for patients with and to detect underlying renal dysfunction. PMID 3884017 10.1186/S40337-024-01024 W. Document the CPD share evidence. Estimated reading time, 5 minutes. Latest, psychiatryai.com #Razor4D. Cool evidence, engaging young people and students in real-world evidence. Real-time evidence search, psychiatry. Enhancing Emotional Abilities in Anorexia Nervosa Treatment, a rolling group cognitive remediation and emotional skills training protocol. June 6, 2024. Evidence. Your Eat Disordered Rev 2024 June 4th. doi 10.1002/of.3113. Online ahead of print. Abstract. Introduction. Anorexia nervosa, AN, is characterized by limited remission rates and emotional dimensions are often neglected. Cognitive remediation and emotional skills training, CREST, protocol aims to address cognitive and emotional factors. This study evaluates the feasibility and effectiveness of a modified rolling group CREST protocol in an inpatient setting. Methods. Quasi-experimental design evaluated CREST protocol in a rehabilitation program. A total of 116 females diagnosed with AN were included, of whom 63 were included in the CREST protocol and 53 in the standard rehabilitation treatment. Various standardized measures were employed to assess psychopathology. Data collection occurred longitudinally, before and after CREST implementation. Results. No significant differences emerged between groups regarding changes in specific eating psychopathology. CREST group exhibited significant improvements in emotion regulation, p equals 0.002, and social skills, p equals 0.014, besides a reduction in alexithymia, p less than 0.001, and cognitive rigidity, p equals 0.013. Empathic features remain stable. Participants reported positive perceptions of the CREST intervention. Discussion. The study highlights the potential benefits of integrating emotional training within multidisciplinary intensive treatment for AN. Results emphasize the importance of treatment protocol with more effective and hot cognition-related interventions beyond weight-related psychopathology. Implementing a rolling group CREST protocol in an inpatient setting showed promise in enhancing the emotional abilities of end patients. PMID 388375559 DOI 10.1002/.3113. Document the CPD share evidence. Estimated reading time 4 minutes. Latest psychiatryai.com #Razor4D. Cool evidence, engaging young people and students in real-world evidence. Real-time evidence search, psychiatry. AI research. Enhancing emotional abilities in anorexia nervosa treatment, a rolling group cognitive remediation and emotional skills training protocol. Title: VR-related evidence matrix. Correction to comparing randomized controlled trials of outpatient family-based or inpatient multimodal treatment followed by outpatient care in youth with anorexia nervosa, differences in populations, metrics, and outcomes. Treatment of patients with anorexia nervosa and comorbid post-traumatic stress disorder, where Welcome to psychiatryai.com, PubMed, Psychiatry AI latest. Skip to the content. Psychiatry AI Razor 4D System Psychiatry plus Mental Health. 3D Brain. A-Frame Sun. About psychiatryai.com. Academic psychiatry. Addiction psychiatry. ADHD. Adolescent psychiatry. Adult BMI calculator, CDC. Aging. AI answer generator. AI bot dolphin. AI evidence search. AI literature review tool. AI therapist beta. Algorithms and psychiatry. AlphaFold protein structure database, Cambridge Genome Campus. Alzheimer's disease. Analytics and psychiatry. Anorexia nervosa. Anti-racism. Antimicrobial resistance. Anxiety. Archives. Art therapy. Artificial intelligence and psychiatry. Augmented reality, AR, psychiatry. Autistic spectrum disorders, ASD. Behavioral science. Bereavement. Big data psychiatry. Bioengineering. Bioinformatics. Biomarkers and psychiatry. Bipolar affective disorder. Borderline personality disorder. Brain MRI McGill University. Bulimia nervosa. Bullying. Burnout. Cambridge psychiatry. Cancer and psychiatry. Case control studies in psychiatry. Child and teen BMI calculator. Child mental health. Child psychiatry. Climate and psychiatry. Clinical trials and psychiatry. Clinical trial psychiatry. CME/CPD certificate. CME radio 24/7 from ReachMD. CNS non-tumor. CNS tumors. Cognitive analytic therapy CAT. Cognitive behavioral therapy CBT. Cognitive disorders. Cognitive science. Cohort studies in psychiatry. Community psychiatry. Complex PTSD. Computer simulation. Conduct disorder. Cool evidence. J-Eat disorder. 2024 June 3, 12/170. DOI 10.1186/S40337-024-01016. W. Abstract. Eating disorders, EDs, are complex, multifaceted conditions that significantly impact quality of life, often co-occur with multiple medical and psychiatric diagnoses, and are associated with a high risk of medical sequelae and mortality. Fortunately, many people recover even after decades of illness, although there are different conceptualizations of recovery and understandings of how recovery is experienced. Differences in these conceptualizations influence categorizations of ED experiences, e.g., long-standing versus short-duration EDs, prognosis, recommended treatment pathways, and research into treatment outcomes. Within recent years, the proposal of a terminal illness stage for a subset of individuals with anorexia nervosa and arguments for the prescription of end-of-life pathways for such individuals has ignited debate. Semantic choices are influential in ED care, and it is critical to consider how conceptualizations of illness and recovery and power dynamics influence outcomes and the ED staging discourse. Conceptually, terminality interrelates with understandings of recovery, efficacy of available treatments, iatrogenic harm, and complex co-occurring diagnoses, as well as the functions of an individual's eating disorder, and the personal and symbolic meanings an individual may hold regarding suffering, self-starvation, death, health, and life. Our authorship represents a wide range of lived and living experiences of EDs, treatment, and recovery, ranging from long-standing and severe EDs that may meet descriptors of a terminal ED to a variety of definitions of recovery. Our experiences have given rise to a shared motivation to analyze how existing discourses of terminality and recovery, as found in existing research literature and policy, may shape the conceptualizations, beliefs, and actions of individuals with EDs and the healthcare systems that seek to serve them. PMID 388314560I 10.1186/S40337-024-01016. W. Document the CPD share evidence. Estimated reading time, 5 minutes. Latest, psychiatryai.com #Razor4D. Cool evidence, engaging young people and students in real-world evidence. Real-time evidence search, psychiatry. AI research. Discordant conceptualizations of eating disorder recovery and their influence on the construct of terminality. Title: VR-related evidence matrix. Characterizing illness stages and recovery trajectories of eating disorders in young people via remote measurement technology. Story: a multi-center prospective cohort study protocol. Dismantling the myth of all foods fit in eating disorder treatment. Examining co-occurring social anxiety in cognitive behavioral therapy for eating disorders. Does it change and does it moderate eating disorder outcomes? Long-term changes in personal recovery and quality. Front Cycle, 2024 May 17, 15:1408695. DOI 10.3389/FPSYG.2024.1408695. Ecollection 2024. Abstract. Introduction. Evidence on parental educational level, PL, as a risk factor for eating disorders, EDs, is mixed, and no study has assessed its role in relation to the compliance and outcomes of treatments in EDs. Further, no study differentiated from the educational level of mothers and fathers, nor considered the possible mediation of perfectionism in fostering EDs. Methods: a clinical sample of 242 first-ever admitted inpatients with EDs provided information on PL and completed the following questionnaires: the Eating Disorder Examination Questionnaire, EDQ, and the Frost Multidimensional Perfectionism Scale, FMVS. Clinicians also provided information on the Hamilton Rating Scale for Anxiety, HAM-A, and the Hamilton Rating Scale for Depression, HAM-D, for each participant. Results: individuals with high PL, whether mothers, fathers, or both parents, showed significantly higher scores on depressive symptoms and lower on parental criticism, were younger, had an earlier age of onset, had fewer years of illness. More were students and employed, and fewer had offspring. Individuals with fathers or both parents with high educational levels suffered more from anorexia nervosa rather than bulimia nervosa, had a longer length of stay during the current hospitalization, had less dietary restraint, and had higher personal standards. Individuals with mothers with high educational levels showed a lower rate of previous substance or alcohol addiction. Personal standards partially mediated the relationship between higher PL and lower dietary restraint. Discussion: PL emerged to be a twofold psychosocial risk factor, being associated with higher depressive symptoms and a longer length of stay, but also with a shorter duration of illness and better scholar and working involvement. Higher PL was related to higher personal standards, but not to global perfectionism. Patterns of eating psychopathology emerged based on the high PL of mothers or fathers. PMID 38827891 PMC, PMC 111401360I, 10.3389/FPSYG.2024.1408695. Document the CPD share evidence. Estimated reading time, 5 minutes. Latest, psychiatryai.com #Razor4D. Cool evidence, engaging young people and students in real-world evidence. Real-time evidence search, psychiatry. AI research. Role of parental educational level as psychosocial factor in a sample of inpatients with anorexia nervosa and bulimia nervosa. Title: VR-related evidence matrix. Established and emerging treatments for eating disorders. Attachment, mentalization, emotion dysregulation, and empathy in eating disorders, comparing anorexic and bulimic patients. in J-Eat Disorder. May 28, 2024. doi 10.1002/eat.24233. Online ahead of print. Abstract. Avoidant/restrictive food intake disorder, ARFID, is a heterogeneous disorder wherein restrictive eating is primarily attributed to non-shape/weight-based reasons, e.g., sensory sensitivity, that empirical research continues to explore. Mounting evidence suggests that ARFID often presents alongside neurodevelopmental diagnoses, NDs, or divergent neurodevelopment broadly. Executive functioning, EF, differences often characterize divergent neurodevelopmental trajectories. Additionally, restrictive eating in anorexia nervosa has been conceptualized as related to EF factors, e.g., set shifting. Given the neurodevelopmental phenotype that may be associated with ARFID and the role of EF in anorexia nervosa, this paper proposes EF as a potentially important, yet understudied factor in ARFID pathology. We posit that various observed ARFID behavioral/cognitive tendencies can be conceptualized in relation to EF differences. We contextualize commonly observed ARFID presentations within core EF components, i.e., cognitive flexibility, working memory, inhibitory control, leading to hypotheses about EF in ARFID. Finally, we offer additional considerations/directions for future research on EF in ARFID. Increased research on EF in ARFID is needed to consider this potential common factor in the etiology and maintenance of this heterogeneous disorder. We aim to promote further consideration of EF in ARFID etiology, maintenance, and treatment outcome research. Public significance. This article proposes that aspects of executive functioning, EF, may play a role in the onset and maintenance of avoidant/restrictive food intake disorder, ARFID, although this notion is largely untested by existing research. Further research on the role of EF in ARFID may assist with refining models and treatments for this heterogeneous disorder. PMID 38804560 DOI 10.1002/eat.24233. Document the CPD share evidence. Estimated reading time, 5 minutes. Latest, psychiatryai.com #Razor4D. Cool evidence, engaging young people and students in real-world evidence. Real-time evidence search, psychiatry. AI research. Conceptualizing avoidant/restrictive food intake disorder by an executive functioning lens. Title: VR-related evidence matrix. Conceptualizing avoidant/restrictive food intake disorder by an executive functioning lens. Lifetime and current mental health based on avoidant/restrictive food intake disorder history versus other eating disorder history in the Healthy Mind Study. Lifetime and current mental health based on avoidant/restrictive food intake disorder history versus other eating disorder history in the Healthy Mind Study. Course of avoidant/restrictive food intake disorder, emergence of overvaluation of shape/weight. Latent profile analysis reveals overlapping ARFID and shape/weight motivations for restriction in eating disorders. Course in J-Eat Disorder. May 28, 2024. doi 10.1002/eat.24233. Online ahead of print. Abstract. Avoidant/restrictive food intake disorder, ARFID, is a heterogeneous disorder wherein restrictive eating is primarily attributed to non-shape/weight-based reasons, e.g., Sensory sensitivity. That empirical research continues to explore. Mounting evidence suggests that ARFID often presents alongside neurodevelopmental diagnoses, NDs, or divergent neurodevelopment broadly. Executive functioning, EF, differences often characterize divergent neurodevelopmental trajectories. Additionally, restrictive eating in anorexia nervosa has been conceptualized as related to EF factors, e.g., set shifting. Given the neurodevelopmental phenotype that may be associated with ARFID and the role of EF in anorexia nervosa, this paper proposes EF as a potentially important, yet understudied factor in ARFID pathology. We posit that various observed ARFID behavioral/cognitive tendencies can be conceptualized in relation to EF differences. We contextualize commonly observed ARFID presentations within core EF components, i.e., cognitive flexibility, working memory, inhibitory control, leading to hypotheses about EF in ARFID. Finally, we offer additional considerations/directions for future research on EF in ARFID. Increased research on EF in ARFID is needed to consider this potential common factor in the etiology and maintenance of this heterogeneous disorder. We aim to promote further consideration of EF in ARFID etiology, maintenance, and treatment outcome research. Public significance. This article proposes that aspects of executive functioning, EF, may play a role in the onset and maintenance of avoidant/restrictive food intake disorder, ARFID, although this notion is largely untested by existing research. Further research on the role of EF in ARFID may assist with refining models and treatments for this heterogeneous disorder. PMID 38804560 DOI 10.1002/E.24233. Document the CPD share evidence. Estimated reading time, 5 minutes. Latest, psychiatryai.com #Razor4D. Cool evidence, engaging young people and students in real-world evidence. Real-time evidence search, psychiatry. AI research. Conceptualizing avoidant/restrictive food intake disorder by an executive functioning lens. Title: VR-related evidence matrix. Conceptualizing avoidant/restrictive food intake disorder by an executive functioning lens. Lifetime and current mental health based on avoidant/restrictive food intake disorder history versus other eating disorder history in the Healthy Mind Study. Lifetime and current mental health based on avoidant/restrictive food intake disorder history versus other eating disorder history in the Healthy Mind Study. Course of avoidant/restrictive food intake disorder, emergence of overvaluation of shape/weight. Latent profile analysis reveals overlapping ARFID and shape/weight motivations for restriction in eating disorders. Course of avoidant/restrictive eating disorders and disordered eating behaviors among undergraduate students in Pakistan as measured by Eating Disorder Examination Questionnaire, EDQ. May 28, 2024. Evidence. Curious. 2024 April 27, 16, 4E59158. DOI 10.7759/curious.59158. eCollection 2024 April. Abstract. Objectives eating disorders, ED, are an emerging public health issue globally, especially in young adults studying at the undergraduate level. This study aims to assess the frequency of eating disorders, their types, and disordered eating behaviors among such students. Moreover, it aims to identify factors like weight concern, shape concern, eating concern, and restraint, along with assessing the shifting trend of BMI impact on eating disorders using a standardized eating disorder examination questionnaire, EDQ. Methods in this cross-sectional study: 400 undergraduate students, aged 18 to 25, from 4 public universities participated from July 2022 to November 2023. Data was collected using the Eating Disorder Examination Questionnaire, EDQ. The frequency of eating disorders was computed using SPSS version 27. Results among the participants: 21.75%, N equals 84, were identified as having a score surpassing the clinical cutoff. This group comprised 5.5% males, N equals 22, and 16% females, N equals 64. The highest prevalence among the 4 subscales was observed in the shape concern subscale, 10.5%. Objective binge episodes, 19.3%, emerged as the most notable disordered eating attitude. Atypical anorexia nervosa accounted for 13.8% of different eating disorders, while disordered eating was noted in 19.5%, N equals 78, of individuals. Discussion: The study offers critical insights into eating disorders among Pakistan undergraduate students utilizing the EDQ 6.0. Disordered eating behaviors, particularly shape concern and objective binge eating, exhibit significant correlations with these disorders. Weight dissatisfaction emerges as a prominent predictor, suggesting societal influence. The study also reveals a moderate correlation between BMI and eating disorders, challenging conventional assumptions. Furthermore, a changing trend in the prevalence of eating disorders is observed among the male population. PMID 38803725 PMC, PMC 111296112 DOI 10.7759/curious.59158. Document the CPD share evidence. Estimated reading time, 5 minutes. Latest, psychiatryai.com #Razor4D. Cool evidence, engaging young people and students in real-world evidence. Real-time evidence search, psychiatry. AI research. Eating disorders and disordered eating behaviors among undergraduate students in Pakistan as measured by Eating Disorder Examination Questionnaire, EDQ. Title: VR-related evidence. Differences in treatment trajectory following brief pediatric inpatient admissions for children and young people with eating disorders. May 26, 2024. Evidence. Your Eat Disordered Reverend, May 25, 2024. DOI 10.1002/of.3105. Online ahead of print. Abstract. Objective: little is known about factors associated with treatment trajectory following brief pediatric admissions for children and young people, CYP, admitted for medical complications of their eating disorder, ED. This project aimed to identify possible factors and ways to improve the usefulness of pediatric admissions. Method: retrospective NHS data was analyzed to explore differences between pediatric admissions followed by community-based care or inpatient psychiatric care. 12 parents were interviewed to seek feedback about pediatric admissions. Results: patients who received subsequent inpatient psychiatric care were unwell for longer, had longer pediatric admissions and more crisis team input, were more likely to have had previous admissions, and had higher parent-reported anxiety and depression. However, the groups did not significantly differ in ED severity. The interviews identified recommendations for improving pediatric admissions, which included improving understanding of EDs, enhancing communication channels, and providing psychological support to parents. Conclusions: factors linked with illness severity, but not illness severity itself, appear to be associated with the difference between CYP either returning to community-based care or requiring more intensive psychiatric input. These factors may help clinicians understand who requires subsequent inpatient care, allowing clinicians to target more intensive support earlier and facilitate smoother transitions between services. PMID 387953855 DOI 10.1002/.3105. Document the CPD share evidence. Estimated reading time 4 minutes. Latest, psychiatryai.com #Razor4D. Cool evidence, engaging young people and students in real-world evidence. Real-time evidence search, psychiatry. AI research. Differences in treatment trajectory following brief pediatric inpatient admissions for children and young people with eating disorders. Title: VR-related evidence matrix. Length of hospital stay and involuntary admissions in Greece, a 10-year retrospective observational study. Inpatient admissions and mortality of anorexia nervosa patients according to their preceding psychiatric and somatic diagnoses. Nasogastric tube feeding under physical restraint of children and young people with mental disorders, a comprehensive audit and case series across pediatric wards in England. The impact of the COVID-19 pandemic on children and adolescent mental health inpatient service use in England, interrupted time series analysis of national patient records. Association of dexmedetomidine use with hemodynamics, postoperative recovery, and cost in pediatric anesthesia, a hospital registry study. Bioelectrical impedance vector analysis, nutritional ultrasound, and hand grip strength as innovative methods for monitoring critical anorexia nervosa physical recovery, a pilot study. May 25, 2024. Evidence. Nutrients. 2024 May 20, 16, 10-15-39. DOI 10.3390/new16101539. Abstract. Eating disorders, EDs, manifest as persistent disruptions in eating habits or related behaviors, significantly impacting physical health and psychosocial well-being. Nutritional assessment in ED patients is crucial for monitoring treatment efficacy. While dual-energy X-ray absorptiometry, DEXA, remains standard, interest in alternative methods such as bioelectrical impedance vector analysis, BIVA, and nutritional ultrasound, NU, has risen due to their affordability and portability. Additionally, hand dynamometry offers a user-friendly approach to assessing grip strength, HGS, indicative of nutritional status. A prospective study was carried out to evaluate the utility of BIVA, NU, and HGS in 43 female and patients. Measurements were taken at baseline and hospital discharge. A total of 41 patients completed the study. After the intervention, Numerous BIVE-related parameters such as fat, 3.5 plus or minus 2 kilograms versus 5.3 plus or minus 2.7 kilograms, p less than 0.001, and free fat mass, 33.9 plus or minus 3.8 kilograms versus 37.5 plus or minus 4.1 kilograms, p less than 0.001, were partially restored. Similarly, nutritional ultrasound showed promising results in assessing body composition changes, such as total abdominal fat tissue. 0.5 plus or minus 0.3 centimeters versus 0.9 plus or minus 0.3 centimeters, p less than 0.05. In the same way, rectus femoris cross-sectional area values correlated with clinical outcomes such as free fat mass, 0.883, p less than 0.05, and appendicular muscle mass, 0.965, p less than 0.001. HGS reached the normality percentile after the intervention, 21.6 plus or minus 9.1 kilograms versus 25.9 plus or minus 12.3 kilograms, p less than 0.05, demonstrating a significant association between grip strength and body composition parameters such as free fat mass, 0.658, p less than 0.001, and appendicular muscle mass, 0.482, p less than 0.001. Incorporating BIVA- and NU- and HGS-enhanced nutritional assessment into the treatment of N patients offers cost-effective, portable, and non-invasive alternatives to DEXA. These techniques offer valuable insights into changes in body composition and nutritional status, which, in turn, facilitate treatment monitoring and contribute to improved patient outcomes. PMID 38794777DOI 10.3390/NU16101539. Document the CPD share evidence. Estimated reading time, 5 minutes. Latest, psychiatryai.com #. Results: a total of 766 articles were identified, 186 eliminated as duplicates. A total of 580 articles were analyzed on the basis of title and abstract, and 67 articles were selected for full-text analysis. A total of 37 studies analyzed the prevalence of EDs in Spain. Conclusions: this is the first scoping review to analyze the prevalence of EDs in Spain. Puberty and adolescence are the most extensively studied stages. There is a high heterogeneity in the use of ED screening tools and a paucity of information on diagnostic tools. PMID 38794750DOI 10.3390/NU16101513. Document the CPD share evidence. Estimated reading time, 3 minutes. Latest, psychiatryai.com #Razor4D. Cool evidence, engaging young people and students in real-world evidence. Real-time evidence search, psychiatry. AI research. A scoping review of the prevalence of eating disorders in Spain. Title: VR-related evidence matrix. Prevalence and etiology of eating disorders in polycystic ovary syndrome, a scoping review. Suicide interventions in Spain and Japan, a comparative systematic review. Similarities and differences in the prevalence and risk factors of suicidal behavior between caregivers and people with dementia, a systematic review. Prevalence of eating disorders and comorbidity with depression among adolescents in Saudi Arabia, a cross-sectional study. The burden of pelvic pain associated with endometriosis among women in selected European countries and the United States, a restricted systematic review. Panic disorder during pregnancy, a scoping review. How mobile applications can support mental health response in natural disasters, a scoping review. Effectiveness of oral health interventions among children and adolescents with mental disorders, a systematic review. Lived experience and family engagement in psychiatry research, a scoping review of reviews. Mind-body interventions for youth with chronic medical conditions, a scoping review of the literature. A scoping review of incidence and assessment tools for post-intensive care syndrome following cardiac surgery. Prevalence of opioid use in nursing homes over the last decade, a systematic literature review. A systematic review of research on illicit substance use and a meta-analysis of its prevalence among college students in Turkey. A systematic review of research on illicit substance use and a meta-analysis of its prevalence among college students in Turkey. Unmasking the Struggle, a scoping review exploring post-traumatic stress symptoms in caregivers of individuals with neurodevelopmental, psychiatric, and neurocognitive disorders. Eating disorders among international migrants, a systematic review and meta-analysis. Intensive cognitive behavioral therapy for adolescents with anorexia nervosa outcomes before, during, and after the COVID-19 crisis. May 25, 2024. Evidence. Nutrients. 2024 May 8, 16, 101411. DOI 10.3390/new16101411. Abstract. Studies comparing treatment outcomes in patients with eating disorders before and during the coronavirus, COVID-19, pandemic have yielded conflicting results. Furthermore, no study has yet evaluated treatment outcomes in adolescent patients with anorexia nervosa before, during, and after the crisis. Hence, this study investigated the outcomes of an intensive cognitive behavioral therapy enhanced (CPT) program on adolescents with anorexia nervosa consecutively treated before N equals 64, during N equals 37, and after N equals 31, the period of emergency spanning March 8, 2020 to March 31, 2022. Results show consistent and similar improvements in eating disorder psychopathology, general psychopathology, and body mass index for age percentiles across all 3 periods, with approximately 60% of patients maintaining a full response at the 20-week follow-up, suggesting that treatment efficacy remained robust. Overall, the study underscores the effectiveness of intensive CBT as a viable treatment option for adolescents with anorexia nervosa, even during and after unprecedented challenges such as those posed by the COVID-19 pandemic. PMID 38794649DI 10.3390/new16101411. Document the CPD share evidence. Estimated reading time, 3 minutes. Latest, psychiatryai.com #Razor4D. Cool evidence, engaging young people and students in real-world evidence. Real-time evidence search, psychiatry. AI research. Intensive cognitive behavioral therapy for adolescents with anorexia nervosa outcomes before, during, and after the COVID-19 crisis. Title: VR-related evidence matrix. Illness duration and treatment outcome of intensive cognitive behavioral therapy in adolescents with anorexia nervosa. New aspects in etiology and treatment of adolescent anorexia nervosa, a postulated biopsychosocial model, and the impact of the COVID-19 pandemic. Neuromodulation of eating disorders, a review of underlying neural network activity and neuromodulatory treatments. Reimagining care, effectiveness of modifying an adolescent eating disorder intensive service. Cognitive impulsivity in anorexia nervosa in correlation with Int J. Molsai, 2024 May 18, 25, 105516. DOI 10.3390/IJMS 25105516. Abstract. Disordered eating behavior differs between the restricting subtype, ANR, and the binging and purging subtype, ANBP, of anorexia nervosa, AN. Yet, little is known about how these differences impact fatty acid, FA, dysregulation in N. To address this question, we analyzed 26 FAs and 7 FA lipogenic enzymes, 4 desaturase and 3 elongases, in 96 women, 25 ANR, 25 ANBP, and 46 healthy control women. Our goal was to assess subtype-specific patterns. Lauric acid was significantly higher in ANBP than in ANR at the fasting time point, P equals 0.038, and displayed significantly different postprandial changes 2H after eating. ANR displayed significantly higher levels of N, 3-alpha-linolenic acid, stearidonic acid, eicosapentaenoic acid, EPA, docosapentaenoic acid, and N, 6-linoleic acid and gamma-linolenic acid compared to controls. ANBP showed elevated EPA and saturated lauric acid compared to controls. Higher EPA was associated with elevated anxiety in ANR, P equals 0.035, but was linked to lower anxiety in ANBP, P equals 0.043. These findings suggest distinct disordered eating behaviors in and subtypes contribute to lipid dysregulation and eating disorder comorbidities. A personalized dietary intervention may improve lipid dysregulation and enhance treatment effectiveness for N. PMID 387915555 DOI 10.3390/IJMS 25105516. Document the CPD share evidence. Estimated reading time, 4 minutes. Latest, psychiatryai.com #Razor4D. Cool evidence, engaging young people and students in real-world evidence. Real-time evidence search, psychiatry. AI research. Fatty acids and their lipogenic enzymes in anorexia nervosa clinical subtypes. Title: VR-related evidence matrix. Attachment, mentalization, emotion dysregulation, and empathy in eating disorders, comparing anorexic and bulimic patients. Attachment, mentalization, emotion dysregulation, and empathy in eating disorders, comparing anorexic and bulimic patients. Cognitive impulsivity in anorexia nervosa in correlation with eating and obsessive symptoms, a comparison with healthy controls. Corpus callosum morphology and relationships to illness phenotypes in individuals with anorexia nervosa. Food beliefs and the risk of orthorexia in patients with inflammatory bowel disease. Food beliefs and the risk of orthorexia in patients with inflammatory bowel disease. Stomach size in anorexia nervosa, a new challenge? The fatty acid omega hydroxylase genes, CYP4 family, in the progression of metabolic dysfunction-associated steatotic liver disease. Your Investig Health Cycle EDUC, 2024 May 15, 14, 51425-1436. DOI 10.3390/AGYP140500094. Abstract. Eating disorders have serious physical, mental, and social consequences that can affect the quality of life of the sufferer. This study aimed to evaluate the relationship between the severity of ED-related psychopathology and clinical impairment in adolescents with anorexia nervosa, (AN), as well as their perception of health-related quality of life. 86 Spanish young women with and completed a set of questionnaires assessing eating disorder pathology, clinical impairment, and quality of life. The set included the following instruments: the Eating Disorder Examination Questionnaire, Clinical Impairment Assessment, Short Form, 12-item health survey, and the Eating Disorder-specific health-related quality of life instrument. Descriptive and regression analyses were applied to identify associations between variables. Higher scores on clinical impairment domains were associated with greater impairment of mental and physical health. Moreover, clinical impairment domains and concerns due to ED were related to a lower quality of life. In conclusion, adolescents with and have a poor quality of life. Moreover, the findings suggest that the clinical features of impairment may serve as severity indicators of quality of life. PMID 387855592 DOI 10.3390/AGYP140500094. Document the CPD share evidence. Estimated reading time, 4 minutes. Latest, psychiatryai.com #Razor4D. Cool evidence, engaging young people and students in real-world evidence. Real-time evidence search, psychiatry. AI research. Quality of life and clinical impairment in Spanish adolescent anorexia nervosa patients. Title: VR-related evidence matrix. Fear of negative evaluation and intolerance of uncertainty, assessing potential internalizing correlates of eating disorder-related clinical impairment and differences across diagnostic presentations. Fear of negative evaluation and intolerance of uncertainty, assessing potential internalizing correlates of eating disorder-related clinical impairment and differences across diagnostic presentations. Self-reported health-related quality of life in children and adolescents with an eating disorder. Food beliefs and the risk of orthorexia in patients with inflammatory bowel disease. Food beliefs and the risk of orthorexia in patients with inflammatory bowel disease. The relationship between fatigue and quality of life in the Turkish mothers of children with autism spectrum disorder. Self-reported health-related quality of life in children and adolescents with an eating disorder. Illness duration and treatment outcome of intensive cognitive behavioral therapy in adolescents with anorexia nervosa. Neuromodulation of eating disorders, a review of underlying neural network activity and neuromodulatory treatments. Food beliefs and the risk of orthorexia in front microbial. 2024 May 9, 15:13969932. DOI 10.3389/FMIC.2024.13969932. eCollection 2024. Abstract. Background: anorexia nervosa, AN, and bulimia nervosa, BN, poses a significant challenge to global public health. Despite extensive research, conclusive evidence regarding the association between gut microbes and the risk of AN and BN remains elusive. Mendelian randomization, MR, methods offer a promising avenue for elucidating potential causal relationships. Materials and methods: genome-wide association studies, GWS. Datasets of AN and BN were retrieved from the OpenGWS database for analysis. Independent single nucleotide polymorphisms closely associated with 196 gut bacterial taxa from the ME Biogen Consortium were identified as instrumental variables. MR analysis was conducted utilizing our software, with outlier exclusion performed using the MR-Presso method. Causal effect estimation was undertaken employing 4 methods, including inverse variance weighted sensitivity analysis, heterogeneity analysis, horizontal multivariate analysis, and assessment of causal directionality were carried out to assess the robustness of the findings. Results: a total of 196 bacterial taxa spanning 6 taxonomic levels were subjected to analysis. 9 taxa demonstrating potential causal relationships with AN were identified. Among these, 5 taxa, including Peptostreptococci, were implicated as exerting a causal effect on AN risk, while 4 taxa, including gamma proteobacteria, were associated with a reduced risk of AN. Similarly, 9 taxa exhibiting potential causal relationships with BN were identified. Of these, 6 taxa, including Clostridiols, were identified as risk factors for increased BN risk, while 3 taxa, including Oxalobacteriaceae, were deemed protective factors. Lacnospiraceae emerged as a common influence on both AN and BN, albeit with opposing effects. No evidence of heterogeneity or horizontal pleiotropy was detected for significant estimates. Conclusion: through MR analysis, we revealed the potential causal role of 18 intestinal bacterial taxa in AN and BN, including Lacnospiraceae. It provides new insights into the mechanistic basis and intervention targets of gut microbiota-mediated AN and BN. PMID 3878480 PMC, PMC 1111191 DOI 10.3389/FMIC.2024.13969932. Document the CPD share evidence. Estimated reading time: 5 minutes. Latest: psychiatryai.com #Razor4D. Cool evidence: engaging young people and students in real-world evidence. Real-time evidence search: psychiatry. AI research. Anorexia nervosa and bulimia nervosa, a Mendelian randomization study of gut microbiota. Title: VR-related evidence matrix.